A very good morning, everybody. Today we will be dealing with the norma lateralis. When we view the skull from the lateral side or from the side, that is known as norma lateralis. Now, what are the different bones that form the norma lateralis? So, to begin with, this bone is the frontal bone. So we have part of the frontal bone, we have part of the parietal bone, we have part of the squamous, the mastoid, and the zygomatic part of this bone, that is the temporal bone. Then a bit of the occipital part, the occipital bone as well. Then here we have the zygomatic bone, part of this bone, that is the sphenoid, part of the maxilla as well. So these are the different bones that form the norma lateralis: frontal, parietal, temporal, occipital, sphenoid, zygomatic bone, and the maxilla. Now, what are the different features we see in the normal lateralis? To begin with, there are two important lines that are known as the temporal lines. तो जैसे हम लोगों ने ऑक्सीपिटल लाइंस देखी थी, वैसे ही हमारे पास टेम्पोरल लाइंस है. टेम्पोरल लाइंस में हमारे पास सुपीरियर एंड इंफीरियर टेम्पोरल लाइंस होती हैं. बोथ बिगिन फ्रॉम द frontal process of the zygomatic bone. This bone here is a zygomatic bone which has a frontal process and a temporal process. So looking at the frontal process of the zygomatic bone, so to begin with, it starts from the frontal process of the zygomatic bone, the superior and the inferior temporal line. When we look at the superior temporal line, it begins from this process, moves upwards, and then it becomes indistinct. What is attached to the superior temporal line? We have attachment of the temporalis fascia. Okay, temporal fascia. Then just below and parallel to this line, we have, so we had a superior temporal line, then we have an inferior temporal line that runs parallel to the superior temporal line. It moves backwards and then it becomes continuous posteriorly here with this prominence. As you can see, this prominence here that is present on the superior part of the external auditory meatus is known as the supramastoid crest. Supramastoid crest. So two lines: superior temporal line which starts from this point but becomes indistinct, temporal fascia is attached here, whereas the inferior temporal line begins from the same part, moves backwards and becomes continuous with this prominence that is known as the supramastoid crest. What is attached to the inferior temporal line? Temporalis muscle is attached here. Okay, then we have this point here. You can see this point here. I told you in the last lecture, we have an H-shaped suture here. So this point here is known as the pterion. The pterion, it is a circular area here. Here we have attached, we have different bones that meet here. We have the frontal bone. This is the part of the parietal bone. This is the part of the sphenoid, and this is the part of the temporal bone. So four bones meet here, and this H-shaped suture is known as the pterion. When we look at it, it is located about 4 centimeters above the zygomatic arch and about 3.5 centimeters behind the frontozygomatic suture. This is the suture that is present between the frontal bone and the zygomatic bone, known as the frontozygomatic suture. So this is present about 4 centimeters above the zygomatic arch and 3.5 centimeters behind the suture. Now, what is its importance? The middle meningeal vein and the anterior branch of the middle meningeal artery runs deep to it. Okay, very important question. दो सवाल आपसे पूछते हैं यहाँ पे. टीरियन की क्लिनिकल इंपॉर्टेंस. तो टीरियन से जब आप अंदर स्कल में देखेंगे, so we have anterior branch of the middle meningeal artery which runs here along with the middle meningeal vein, and we have stem of the lateral sulcus of the brain that lies deep to this point. टीरियन पूछा जाता है. ठीक है. Then what is the other thing we see here? This thing. This is known as the zygomatic arch. The zygomatic arch is formed by the temporal process of the zygomatic bone. I told you we have a frontal process, we have a temporal process. So the temporal process of the zygomatic bone, and this bone is a temporal bone. It has this process that is known as the zygomatic process of the temporal bone. So temporal process of the zygomatic bone and the zygomatic process of the temporal bone. When we look at this, we have two surfaces and two borders. This is the superior border, the inferior border, two surfaces. This is the outer surface, and this here will be the inner surface. The outer surface is subcutaneous and it is crossed by some structures which arise from the superior border of the parotid gland. What are these structures? We have the auriculotemporal nerve and we have superficial temporal superficial temporal vessels. So auriculotemporal nerve, and so इसके ऊपर ऐसे होगा, ये subcutaneous है, you can feel it. इसमें से pass होती है auriculotemporal nerve and superficial temporal vessels. Here you can see there is a red portion here. That means there is an origin of some muscle here. So masseter muscle, that is one of the muscles of mastication. Muscle of mastication, masseter, originates from the inner surface and the lower border. Temporal fascia is attached here. Then when we look at the posterior end, looking at it like this, okay, so the posterior part of the lower end is marked by this tubercle that is known as the tubercle of the root of zygoma. Here we have attachment of the lateral ligament of the temporomandibular joint. When we look at this posterior tubercle, the root of the zygomatic arch, this portion, that is the root of the zygomatic arch, now diverges from the tubercle into an anterior root and a posterior root. The anterior root आगे की तरफ आता है, passes medially in front of this fossa that is known as the mandibular fossa, and the posterior root moves backwards and becomes continuous with this ridge that is known as the supramastoid crest. Okay, so dobara to look at it, we saw that this this is the zygomatic arch formed by the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. Outer surface, inner surface, upper border, lower border. Outer surface is subcutaneous, crossed by auriculotemporal nerve and superficial temporal vessels. Masseter takes origin from the lower border and the inner surface. Upper border gives attachment to the temporal fascia. When we look at it on the posterior end of the lower border, we have this tubercle. This tubercle is known as the tubercle of the root of the zygoma, to which is attached the lateral ligament of the temporomandibular joint. Then this portion, which is known as the root of the zygoma, when we look at it from the tubercle, this root of zygoma diverges, forms an anterior root which passes medially in front of this thing that is known as the mandibular fossa, and posteriorly this portion that is known as the posterior root of zygoma that goes and becomes continuous with the supramastoid crest. Here. Okay, then we have this opening here. This is known as the external acoustic meatus or the external auditory meatus. It is located behind the mandibular fossa and it lies below the posterior root of the zygoma. This opening has an anterior wall, this one, a floor, that is this, posterior wall. Okay. Now the anterior wall, the floor and the part of the posterior wall is formed by the tympanic part. The tympanic part, the upper, while as the upper part of the posterior wall is formed by the squamous part of the temporal bone. So when we look at the temporal bone, we will see that it has different parts. It has a squamous part, it has a it has a tympanic part, it has a zygomatic part. So this portion, so the external auditory meatus here has an anterior wall, a floor, a posterior wall, and a roof. The anterior wall, the floor, and a part of the posterior wall is formed by this thin plate you can see here, that is known as the tympanic part of the temporal bone, whereas the posterior part of the roof as well as the posterior part of the wall is formed by the squamous part of the temporal bone. The margins of this meatus will give attachment to the cartilaginous part of the external auditory meatus. Now, when you look at this projection here, that is known as the supramastoid crest, if we draw a tangent from the posterior part of the external auditory meatus like this, we have an angle, we have a triangle that is formed between this supramastoid crest and a tangent that is drawn from here. This triangular area here, you can see the triangular area formed here. This is known as McEwan's triangle or suprameatal triangle. So basically we have a tangent that is drawn like this, and then this triangle that is formed is known as the suprameatal triangle. There is a projection that is seen sometimes here that is known as the spine of Henle. The importance of this suprameatal triangle is that the mastoid interim is located about 12.5 millimeters deep to this point. Then we have this projection we see here. This is the mastoid process. The mastoid process projects downwards. It gives attachment to some muscles. We have the sternocleidomastoid, the splenius capitis, and the longissimus capitis. On the medial surface, it has a notch here that is known as the digastric notch, which gives attachment to the posterior belly of the digastric muscle. Then there is a projection that comes out from this point, which we don't see here because it is broken, that is known as the styloid process. A styloid process is a cylindrical projection that lies between the external auditory meatus in front and the mastoid process behind. It gives attachment to some muscles, which are the styloglossus muscle, the stylohyoid, the stylopharyngeus, and two ligaments. We have the stylomandibular ligament and the stylohyoid ligament. So these are some important features we see on the norma lateralis. Then we have some fossas that are related to this norma lateralis. What are these? We have the temporal fossa. So what is a temporal fossa? This area here forms a bit of depressed area. This area here is known as the temporal fossa. Now when you look at the temporal fossa, looking at this portion is a temporal fossa. The portion below the zygomatic arch, this is the infratemporal fossa. Looking at the temporal fossa, what are the different boundaries? Anteriorly, this fossa is bounded by this bone, that is the zygomatic bone. Superiorly, it is bounded by the superior temporal line. Posteriorly, it is bounded by the superior temporal line and the supramastoid crest. Whereas inferiorly, it is bounded by the zygomatic arch. So, ये portion is the temporal fossa. Anteriorly, zygomatic bone, वहाँ से superior temporal line, पीछे superior temporal line and the supramastoid crest and the zygomatic arch. फोसा है यानी डिप्रेस्ड एरिया है थोड़ा सा, तो उसकी कुछ बाउंड्रीज होंगी। एंटीरियर वॉल होगी, एंटीरियर वॉल, पोस्टीरियर वॉल होगी, फ्लोर होगा। सो एंटीरियर वॉल इसकी किससे बनती है? एंटीरियर वॉल इज फॉर्म्ड बाय दिस बोन। आई सेड दिस इज द zygomatic bone. The zygomatic bone की ये surface is known as the temporal surface of the zygomatic bone. So it is formed by the temporal surface of the zygomatic bone, by this a part of this bone that is the greater wing of the sphenoid and part of the frontal bone. So ye and a part of this forms the anterior wall. Floor, if you look at the floor, it's formed by the frontal, the parietal, the temporal and the greater wing of the sphenoid head. टेम्पोरल मसल इस पूरे पे, ये जो उसने रेड दिखाया है, टेम्पोरालिस मसल हमारा लगता है, ठीक है। सो दोबारा, दिस फोसा is a temporal fossa bounded anteriorly by the zygomatic bone, then superior, मतलब इसकी boundaries, superior temporal line, posteriorly superior temporal line and supramastoid crest, inferiorly तुम्हारी zygomatic arch, ठीक है। ये fossa है, इसकी एक anterior wall है। This anterior wall here is formed by this portion, that is the temporal surface of the zygomatic bone, part of the sphenoid bone and part of the frontal bone. फ्लोर किससे बन रहा है? सारी बोन जो टीरॉन बना रही थी उसी से फ्लोर बन रहा है। फ्रंटल, पैराइटल, टेम्पोरल और स्फेनॉइड। क्या लगता है? टेम्पोरालिस मसल लगता है। उसके अलावा और क्या कंटेंट्स हैं यहाँ पे? सो वी हैव मिडिल टेम्पोरल आर्टरी, वी हैव डीप टेम्पोरल आर्टरी, वी हैव अ zygomatic-temporal nerve which appears from here. यहाँ पे एक माइन्यूट फोरामेन होता है, ये दिख रहा है आपको। इस छोटे फोरामेन से zygomatic-temporal nerves आती हैं और आर्टरी आती है, और डीप टेम्पोरल nerves. So basically we have middle temporal artery, we have deep temporal nerves and arteries, and we have a zygomatic-temporal nerve that comes out from the temporal fossa. That are the contents of the temporal fossa. Then talking about the infratemporal fossa. Now infratemporal fossa is an irregular space that is present below the zygomatic arch. So I said ये वाला पोर्शन टेम्पोरल फोसा, इसके नीचे ये फोसा, ये दिख रहा है डिप्रेस्ड एरिया पूरा, ये पूरा इंफ्राटेम्पोरल फोसा कहलाएगा। जब इस पोर्शन की हम बाउंड्रीज देखेंगे, सो क्या बाउंड्रीज होंगी? ये एंटीरियर वॉल है। एंटीरियर वॉल किससे बन रही है? ये हमारा मैक्सिला है, मैक्सिला की पोस्टीरियर surface है। So the anterior wall is formed by the posterior surface of the maxilla. The medial wall is formed by this plate that is known as lateral pterygoid plate. यहाँ पे एक ये this is the mandibular fossa, तो normally यहाँ पे mandible होता है। So lateral wall is formed by the mandible, ramus of mandible, whereas the roof, see basically this is the fossa, right? ये जहाँ पे मैंने फिंगर्स रखी, तो इसमें क्या क्या होगा? एक एंटीरियर वॉल होगी, एक मीडियल वॉल होगी, एक लेटरल वॉल होगी और एक रूफ होगा, ठीक है। एंटीरियर वॉल यानी इसका एंटीरियर वॉल, या आप ऐसे देखिए ये रखते हैं यहाँ पे, ठीक है, ये फोसा है। सो एंटीरियर वॉल किससे बन रही है? मैक्सिला की पोस्टीरियर सरफेस से बन रही है। मीडियल वॉल इस पोर्शन से बन रही है, दैट इज़ अ लेटरल टेरिगोइड प्लेट। लेटरल वॉल किससे बनेगी? यहाँ पे नॉर्मली रैमस ऑफ मैंडिबल होता है, उससे बनेगी। उसके अलावा ये पोर्शन दैट फॉर्म्स द रूफ, the roof will be formed by this portion here. This forms the roof. The roof is formed by the greater wing of the sphenoid. We have an infratemporal surface of greater wing of sphenoid. So greater wing of sphenoid, अभी के लिए आप याद रखो greater wing of sphenoid. I hope it is clear. Please ये clarify करना, क्योंकि infratemporal fossa पूरा एक चैप्टर है, फिर आप लोगों को उसकी बाउंड्रीज ही नहीं समझ आती है, ठीक है। तो दोबारा ये गैप हेयर इज़ द इंफ्राटेम्पोरल फोसा। बाउंड्रीज क्या है इंफ्राटेम्पोरल फोसा की? Look at my finger. Anterior boundary formed by the maxilla, medial boundary formed by the pterygoid plate, lateral pterygoid plate, laterally normally ramus of mandible, and this portion forms the roof that is formed by the infratemporal surface of greater wing of sphenoid. Now there are few contents that are present here. We have muscles, we have lateral and medial pterygoid muscles and the temporalis muscle that is present here. We have arteries that are present here. We have maxillary artery and posterior superior alveolar branch of the maxillary artery that is here. Veins, we have maxillary vein, we have pterygoid venous plexus here, we have posterior superior alveolar veins here. Nerves, we have mandibular nerve, chorda tympani, maxillary nerve and posterior superior alveolar nerves. Basically posterior superior alveolar nerves क्या होती हैं, वो यहाँ maxilla को pierce करती हुई जाती है, तो वो इसका कंटेंट बनेगी ही बनेगी. ठीक है, यहाँ मैंने कहा यहाँ maxilla को pierce करती हुई जाती है posterior superior alveolar nerves और vessels. वो कुछ foramens होते हैं यहाँ उससे पास होती है. ठीक है, जिनको posterior superior alveolar, जिनको बेसिकली बस उनको फोरामेंस कहते हैं, जहाँ से posterior superior alveolar nerves और vessels पास होती हैं. ठीक है. नाउ अ वेरी इंपॉर्टेंट थिंग दैट वी हैव फ्यू फिशर्स है. अब फिशर्स को आप अच्छे से देखिए. नाउ बिटवीन दिस पोर्शन है सो वी हैव दिस फिशर. This fissure is present at the junction of the anterior and the medial wall of the infratemporal fossa. This fissure is known as the pterygomaxillary fissure. Why? Because this is the pterygoid plate and this is the maxilla. So this fissure, ये cut जो है, इस cut को हम बोलते हैं pterygomaxillary fissure. ठीक, pterygomaxillary fissure. जब अभी आप ये देखो, मैं भी दिखाती हूँ. टेरिगोमैक्सिलरी ये फिशर है. ठीक है, फिशर के अंदर ये जो कैविटी दिख रही है, जो काला काला दिख रहा है, यानी जो कैविटी, फिशर तो कट है, कट जिसमें लीड कर रहा है, दैट इज नोन एज द टेरिगोपैलेटाइन फॉसा. ठीक, देन द जंक्शन ऑफ रूफ एंड द इंटीरियर वॉल, रूफ और इंटीरियर वॉल के जंक्शन पे वी हैव दिस कट है. ओके, सो ये कट था. अब यहाँ पे एंटीरियर वॉल और रूफ के जंक्शन पे वी हैव दिस कट. दिस कट इज नोन एज, दिस कट हेयर इज नोन एज द inferior orbital fissure. This, okay. So दो fissures important हैं यहाँ पे. एक ये fissure that is known as the pterygomaxillary fissure और एक ये fissure that is known as the infraorbital fissure. ठीक. Now talking about the pterygomaxillary fissure. So this pterygomaxillary fissure, okay, so this pterygomaxillary fissure है, sorry, this fissure है, pterygomaxillary fissure leads into a fossa है. ये यहाँ से ओपन ही नहीं हो रहा फोसा में, तो क्या यहाँ पे ये फोसा होता है, ये डिप्रेशन होता है. ठीक है, फिशर तो कट है, फिशर जिसमें लीड कर रहा है स्पेस में, स्पेस को टेरिगोमैक्सिलरी फिशर जिसमें लीड करता है, इसको टेरिगोपैलेटाइन फोसा कहते हैं. प्लीज़ ये समझना, अगर किसी को प्रॉब्लम होगी तो प्लीज़ आस्क मी अगेन. ठीक है, तो ये फिशर है, फिशर अंदर जिसमें मैंने ये भरा, जिसमें मैंने नीडल भरी, ये फोसा है. फोसा का नाम टेरिगोपैलेटाइन फोसा है. ठीक है, सो टेरिगोमैक्सिलरी फिशर की पहले बात करते हैं. इसकी बाउंड्रीज में आगे मैग्जिला, पीछे टेरिगोइड प्रोसेस। इसमें इंपॉर्टेंस क्या है, मैग्जिलरी आर्टरी एंटर करती है इस अंदर जो फोसा है टेरिगो पैलेटाइन फोसा में थ्रू दिस टेरिगो मैग्जिलरी फिशर, और मैंडिबुलर नर्व इसमें से पास होती है, यहाँ से पास होके फिर इंफ्रा ऑर्बिटल फिशर से जाती है। उसको रहने दो, अभी बस दो चीज़ें पास होती है, एक मैग्जिलरी आर्टरी और मैग्जिलरी नर्व, फिर टेरिगो पैलेटाइन फोसा। अब ये जो फोसा अंदर है, फोसे की बाउंड्रीज में आगे मैग्जिला है, ठीक, पोस्टीरियरी टेरिगोइड प्रोसेस है, ये टेरिगोइड प्रोसेस, और मोर मीडियली, क्योंकि ये थोड़ा नाक की तरफ खुलेगा, नाक की तरफ एक बोन होती है जिसको हम लोग बोलते हैं पैलेटाइन बोन, ठीक है। सो मीडियली अगर हम देखेंगे यहाँ पे वी हैव द परपेंडिकुलर प्लेट ऑफ द पैलेटाइन बोन, पोस्टीरियरली वी हैव द टेरिगोइड प्लेट हेयर, ठीक है। The floor is formed by the fusion of this and this wall. So dobara the boundaries are anteriorly we have the maxilla, posteriorly we have the pterygoid recess and the greater wing of the sphenoid. Medially we have a bone here that is known as the palatine bone. And the floor is formed by fusion of these two, the anterior and the posterior wall. When we look at the pterygopalatine fossa, it communicates with the orbit anteriorly via the infraorbital fissure. It communicates with the middle cranial fossa through the foramen rotundum. Then this portion communicates with the infratemporal, यानी यहाँ जो fossa है that is communicating with the infratemporal fossa through the pterygomaxillary fissure. It communicates through the to the nasal cavities via palatino-vaginal canal and foramen lacerum through the pterygoid canals. ये दूसरा half skull जो है उसमें मैं आप लोगों को clear कराऊंगी. What are the contents? We have third part of the maxillary artery and its branches. We have maxillary nerve and its branches. And we have an important ganglion, that is the pterygopalatine ganglion that is present here. Okay. Now, some of the clinical points associated with the lateral view of the skull. We have the spine of Henle here, which is an important surgical landmark for surgery of the mastoid antrum. Pterion clinically important होता है because anterior branch of the middle meningeal artery वहाँ आती है. So fractures में it may be damaged. If the meningeal vessel in the region of the pterion are damaged, an extradural hematoma is formed. Temporal fascia strongest fascia है that is used in tympanic membrane जो एयर ड्रम की रिकन्स्ट्रक्शन सर्जरीज होती हैं उसमें हमारा tympanic membrane यूज़ होती है. सो अब क्या बोल रहे हैं, टेम्पोरल फेशिया यूज़ होता है, ठीक है. थैंक यू.